I think in some ways, doctors and health professionals have always been influencers. Hopefully we've always had an influence on the lay public in terms of helping to guide their health and wellness, and also helping them navigate the healthcare system when they're not well. However, I think that the precarious times with the mistrust and distrust about science and medicine has to be tempered with what, again, is an opportunity. And I think the opportunity is that because a lot of people, so many people, have a screen and they can do their own research, you're never going to hear me say that that's a bad thing. When it becomes a bad thing is when there's no one to interpret that research or give context or perspective to that research. And that's when one of my favorite sayings is, sometimes the messenger is as important as the message. Yeah, I think there is a crisis in terms of how we get our medical information. I think it's more important now than ever to make sure that it's being obtained from a credible and credentialed source. And not everyone with a few million followers is credentialed, as we all know. It's never a bad time to reiterate that to everyone. You have to ask the right questions. And I always will think that it's better to teach someone how to think like a doctor than teach them a fact that we may learn tomorrow has evolved or is not true, or we learn more. And so it's really how to teach people how to interpret the information that is so readily accessible, and how to say, is this from a credible source? Is this methodology sound? How many people, and when we have people like we do right now, just making statements with a huge platform that not only haven't been proven in rigorous, high-quality medical science, but we know the opposite, I think that literally puts everyone's health at risk. So I think it's an important time.